Welcome back, everyone. I'm still Ed Hickey, still AAKP's president and chair of the Veterans Health Initiative. I thank you for joining us for AAKP's 8th Annual Public Policy Summit titled Midpoint of the Decade of the Kidney, Reprioritizing Patients Across Policy, Regulatory, and Payment Decisions. I'm pleased to kick off our next panel discussion, which will focus on overcoming government determinants of health in kidney care through payment and policy innovation. To start us off, I'm joined by Dr. Suzanne Watnick for a discussion on improving outcomes and reducing costs with timely detection, diagnosis, and intervention of kidney disease. Dr. Watnick is the American Society of Nephrology's health policy scholar in residence and professor of medicine at the University of Washington. Most importantly, she's known to both AAKP and ASN as a tremendous patient advocate who invests an incredible amount of time shaping patient-centered medicine policies. And she's also a good friend. She's joining us this morning live from Washington State for our dialogue. And good morning, Suzanne. How are you?
Ed, thanks so much. It's very kind of you, and I'm deeply honored to even be invited to this. So thank you. I'm looking forward to a robust conversation, really to benefit people with or at risk for kidney diseases.
Well, thank you. And how would more robust kidney disease screening improve health outcomes and delay or prevent progression of kidney failure, especially in underserved and high-risk communities, which it's incredibly inadequate now?
If you think about it in this country, just the millions of people who do have or are at risk for kidney diseases, and it's actually over 800 million people globally who live with CKD. More than 2 million die each year, and half of those are because you don't have access to kidney replacement therapy, but the other half are people who die as a result of other access issues. And, again, if we could detect earlier and make sure to actually utilize beneficial therapies that we know we have, new things such as medications and care pathways, SGLT2 inhibitors, for example, and GLP-1 agonists. And these are things that we know that not only slow down progression of kidney diseases for those who have them, but also there are recommendations to use these medications feeling that it may stave off medications, stave off the sequelae of actually having kidney disease as a result of their medication. So we do think that that's really important. In addition, you asked about vulnerable populations. People who are at risk, vulnerable populations in particular, should be assessed for CKD risk. There's actually a new publication that just came out on Tuesday, believe it or not, thinking about CKD screening and risk screening, not just addressing care for those who already have CKD. So I think that there's progress being made slowly, but there's so much more we can do. And just like Congressman Nadler just mentioned, if we can slow down progression, it of course improves the lives of people with kidney disease or those at risk, but it also saves money. So just putting that out there.
That's great, and it just sort of ties into my next question, which is what are the health and economic implications of delayed diagnosis for the vulnerable populations, especially Black, Latino, Indigenous, and low-income individuals who often present late with kidney disease?
Yeah, I can't say this enough. We need to make sure that we're addressing the risk of kidney disease and even more so the kidney health of everyone, not just one group or another. Those at risk in particular, we know certain racial minorities and certain ethnic minorities actually are at higher risk. So when you have either a chronic illness like hypertension or diabetes, or if you're of certain populations that are at particular risk, your health provider should absolutely be thinking about your kidney health. And again, you can target those groups that may be at very high risk, the groups that I just mentioned, both chronic illness and just general groups within the population. But more than that, your provider should be thinking about how to screen in general for anyone and making sure that kidney health, just like we think about heart health all the time, is addressed. And again, there's evolving literature to specifically make sure that you're screening high-risk groups, and now with new medications to start thinking about cost effectiveness analyses for those who may benefit the greatest. And so again, I would just emphasize that no matter who you are or where you're from, you should be thinking about your health in general, heart health, kidney health, general health, and that's very much part of how it should be addressed. I would just say in particular, if people want to read more about this, KDIGO, the Kidney Disease Improving Global Outcomes Group, has specifically announced its perspective on preventing chronic kidney disease and maintaining kidney health. And note that they specifically say kidney health. They don't want it to get to the point where people have kidney disease. And so when you think about identifying and stratifying individuals for CKD prevention, chronic kidney disease prevention, you have to think about the biologic, the environmental, and the individual lifestyle factors that affect kidney health. And given the diversity, just like you were asking about different populations, ethnic minorities, racial minorities, think about their risk factors and health histories about throughout their lifespan to address kidney health.
And the next question kind of flows from that, which is what are the long-term implications for the American taxpayer if we fail to screen? I think you're aware that we don't believe at AAKP that their interests, the taxpayer interests, are represented enough in the national dialogue about kidney screening.
Yeah, well, I'll be honest, this is actually the area where I've done the most work thinking about cost effectiveness and healthcare benefits for people, especially as they have advanced CKD and require kidney replacement therapy, either with best treatment, transplant if they desire it, or requiring dialysis. So it's extremely expensive. If you think about it, a patient on dialysis costs on the order $100,000 per year. And that is as much about hospitalization as the treatment for dialysis, for example, itself. So if you can prevent kidney disease or slow down its progression, you are not only improving the lives of those people with kidney disease, but you're saving the taxpayer a tremendous financial burden. You know, people forget that people on dialysis account for 1% of the Medicare population, but account for somewhere between 6 to 7% of the Medicare budget. And, you know, we're not talking about 40% more expensive. That is 600% more expensive. And this is actually accounting for 1% of GDP in this country. That's incredible. And that's just talking about the 550,000 people that require chronic dialysis. You're not talking about the expenses of people with advanced chronic kidney disease, who have heart disease, who get hospitalized. Half of people with advanced kidney disease never make it to dialysis. They die, most of them from heart disease. And so thinking about those dialysis patients as actually the survivors is an odd way to think about it. But again, there's a financial and emotional burden to the whole country. And again, financially, it is a tremendous burden. So if we can screen appropriately, detect kidney disease, possibly prevent it, and certainly slow it down, you're going to save a lot in terms of finances for the taxpayer. Thanks for that question, Ed.
My pleasure. In terms of broader screening, how does that enable researchers such as yourself to better identify early stage disease and accelerate the development of innovations, including targeted therapies?
Great question. So, you know, how do we utilize those research tools to actually help us? There's a lot of things we can do. You know, if we specifically think about how to have a longitudinal review of how people do if they had screening up front versus never being subject to screening. We already know that when you screen and detect, you can actually slow down and utilize treatments. I think the one important part about research and innovation right now, as I mentioned initially, there are new therapies. We haven't had a lot of new therapies in the chronic kidney disease field for a long, long time. But medications and drugs development has really accelerated in the last 5 years in terms of what's being used and the studies that we already have. So, we have prior cost effectiveness analyses from over a decade ago saying, hey, not sure it's so beneficial to screen because we don't have a lot of tools to do a lot of stuff with. But that has changed. And this is why we need to do more research now, in particular cost effectiveness analyses, because we may discover that with new therapies, if you detect in the greater population earlier, you can prevent or slow down. And it becomes very cost effective. And some of the larger bodies who make recommendations can see that this is actually beneficial now with the new therapies, the new drugs that we have, and the new potential pathways. So I just make a big call to people to try their best to do that research, to request those funds to benefit the health of the American people.
And then speaking about the new therapies that are out there, without the systematic screening, how many patients do you think are missing out on the opportunity to benefit from these innovations in kidney disease treatment, like SGLT2 inhibitors or the non-invasive biomarkers? If you had a number.
I don't know. And the reason, and the reason I don't know is because we haven't done the research to really get that information. Your question is one of the most important questions. We need to invest now, and it will not just benefit quality of life for individuals, overall productivity for the population, but it will decrease the costs, the financial burden to the taxpayers to find out this question. We also know how many people in this country approximately have hypertension. We know approximately how many people have type 2 diabetes mellitus. We know the burden of obesity. And these three entities are probably the largest risk factors in terms of numbers of people in this country, but there's lots of others as well. And we know that of those groups, there are a lot of people that should be screened, should have blood testing and urine testing that isn't done. And we know there's a gap there, and that gap needs to be filled. So appreciate your question. Sorry, I don't know the exact answer to your question, but it just is a call for research and innovation.
I had a sense that was the answer. But, one final question. And can you speak to how early detection expands access to life-altering interventions and delays the need for dialysis and transplantation?
Absolutely. Yeah, early detection. You don't want to find out that, and this is probably not a good analogy, it's coming off the top of my head. You don't want to find out that your roof is about to collapse when it's already been substantially impacted by weather over a long period of time. You want to know up front that there's the beginning of a problem. Just like any health problem, if you let a health problem persist for too long of a time, there might be very little you can do to prevent or reverse the problems with it. So again, if you can detect kidney disease earlier, you can help slow progression. And with some of the new therapies, we may even be able to halt progression. We know that as we age, we lose a teeny bit of kidney function every year after the age of 40. I'm very sad about that. But we'd like to only do that in terms of natural aging. We do not want people to be put at risk for worsening kidney function if we've missed it earlier. So let's not have a missed opportunity and make sure that all of us help to call for better screening, better education, and really better kidney health in general to improve the lives of people that we love and within our population.
It's wonderful. Thank you, Dr. Watnick, and I assure you we will continue with our push to have the screening, and the message will get out there eventually. And my hope is that one day it will be a national policy. So thank you very much.